Hey everyone, it's Dr. Hodges, and I wanted to talk a little bit today about drinking while you eat when you've had weight loss surgery. This is a common question that I get, and it is certainly a recommendation I have for all of my patients, both in the immediate postoperative period, but also unfortunately, like lifelong. And there's a couple of reasons why. It's not always good to drink while you eat. So I think the first thing is just the architecture of your new stomach after you've had surgery. So if you have a sleeve, your stomach is a long, narrow tube, looks like a sleeve. Um, and if you have a gastric bypass, your stomach is about the size of a golf ball. If you have a duodenal switch, again, your stomach is a sleeve. And in the immediate postoperative period, the walls of your stomach are really, really tense. It's kind of like I'm sitting here at my desk. If I were to jam my finger in a drawer, I wouldn't be able to like bend my finger. It'd be all puffed up and swollen. Well, that's what the walls of your stomach are like after you've had surgery. That's the normal healing process. So there's not a lot of distensibility in your stomach. It's just not as elastic because everything's all swollen and stiff. So that's why initially you can't tolerate much of anything. It's because the volume's smaller, because things can't stretch. Now, over time, that swelling goes down and you can accommodate a little bit more, but it's never going to be like it was when you first had like prior to you having surgery. Now, so number one, why should you not drink while you eat? In the very beginning, you really just don't have the volume to do that. And I think what's important to know is as you're beginning to advance your diet, I do want to be able to see, are you able to tolerate soft foods? And then once you're able to tolerate your soft foods after 4 weeks, then I want to see, okay, what are the types of regular foods can you begin to slowly introduce back into your diet that you can tolerate? And so if you're drinking while you eat, you're filling up your stomach with liquid, and it's going to be a little bit more difficult for your brain to kind of relearn what this new sense of fullness is. And so when you cut on the stomach, or any organ for that matter, you're cutting through some of the cutaneous nerves or the peripheral nerves, and those nerves send signals back to your brain. And so it's kind of like, have you ever heard of these like little old ladies, and God forbid they have to have their foot amputated and their foot's gone, and now they're like, my foot hurts. And it's like, Grandma, your foot's not there. So why do you think that your foot hurts? Well, it's because their brain hasn't really processed, and their nerves are kind of freaking out, and they're still trying to send signals to your brain, and all the signaling pathways are kind of cattywampus. That's your stomach right after surgery. So I have cut through your stomach, either waxed some stomach off, or I've made your stomach smaller. And so all those little nerves are kind of cattywampus. They're kind of like discombobulated. And your stomach has pressure receptors that once they get activated to a certain amount, they'll send a signal to your brain to tell you that you're full. Well, whenever you're cutting on the stomach or removing stomach, all those signaling pathways are kind of dysregulated a bit because of surgery. Some of it's going to be permanent, not permanent dysregulation, but some of those pathways are going to be changed permanently just because there's no more stomach there. But other times it's because the walls of your stomach are just really, really tense. So that would be number one. That would be the one reason why I don't want you drinking while you're eating, like once you begin to incorporate soft food and then ultimately regular food into your diet, just because you simply don't have the volume in the beginning to do so. I think the second reason why I don't want you doing that is it really increases your risk for developing dumping syndrome. So what is dumping syndrome? Dumping syndrome is whenever you take in too much carbohydrate or even fat, and it kind of gets into the intestine, and then you have an even bigger release of insulin from your pancreas. And so you have a great big drop in that glucose, your blood glucose. And so you have symptoms of low blood sugar, and you can get shaking, you can get nauseated, your heart can race, you can get all sweaty. You basically feel like crap for about 30, 40 minutes. And so my husband calls it his gastric shakes. And so if you are drinking while you're eating, you're filling up your stomach a little bit sooner than it should, and you're also mixing the solid food with liquid, and so it's allowing that food to kind of get liquefied quicker. And so that's going to be able to more easily pass into your digestive tract. And so it predisposes you to, or it puts you at risk for developing dumping syndrome. So that'd be reason number 2, don't drink while you eat. Number 3, I think the third thing is that, sometimes if people eat a little bit too fast, if they take a little bit too big of a bite, if they eat food that's a little bit too dense or dry, it might feel like something's getting stuck. And so you think, if I just drink, that's going to help push it down. No, water's not going to help push it down. It's kind of like if your toilet's plugged up and you keep flushing the little flusher, that doesn't make whatever's stuck in the toilet pass through, everything backs up, and then you get sick. That is exactly what's going to happen if you take too big of a bite, or if you feel like something gets stuck, you're going a little bit too fast. So drinking more liquid, it's just going to stack on top of one another. So moral of the story, try not to drink while you eat. I will tell you, my husband, he had his gastric bypass, I don't know, I think it was in 2012. And even to this day, I mean, he gets a drink while we go out to dinner or whenever we have dinner. He might have a little bit, like here's my iced coffee. You can see I've only had just a little bit. Prior to dinner, and even while he's eating, he might drink about this much. And then he might have a little bit after we eat. But he never drinks an entire thing of iced tea. So I don't want you to think you can't have anything, like if you want to wet your whistle, but if you're drinking while you eat the same way that you did prior to your surgery, probably going to set yourself up for some failure. So don't do it. Just don't do it. Okay? But hope that this helped, and now you know why you shouldn't drink while you eat.